Hi, I'm Dr. Dane Happney, physical therapist with Healing Motion Physical Therapy, and I'm going to talk to you about low back pain. Low back pain is the #1 cause for disability in the entire world, and it has a big lifetime prevalence of pretty much everyone's going to experience low back pain at some point in their life. It can be one episode, you can have multiple episodes, or you can have chronic low back pain where it seems like it's been difficult to kick. Well, I'm going to go ahead and kind of debunk a couple myths and kind of tell you the truths about low back pain. So the biggest thing with low back pain is it can hurt a ton. And the biggest thing to know is that hurt does not equal harm. And so really with low back pain, there's a couple things that we know. Number one, just make sure that there was a mechanical onset of it. Like it makes sense with what you were doing. You were lifting or moving or using your back. Kind of makes sense that it would hurt you. If you kind of have a random low back pain that kind of seems out of the blue, especially if it's hurting you at night or is on this 24-hour pattern or hurting when you're eating, then that's something that you'd want to see your primary care physician about, just to make sure that there's no other serious issues. But the majority of the time, it's mechanical, meaning that you moved and you kind of tweaked something to have your low back pain. Now, the biggest thing is that most low back pain does resolve on its own. Usually you hurt it and it gets better on its own. That said, there's a fair amount of research out there that shows that when you have low back pain, if you do see a physical therapist within the first 2 weeks of that onset, that your likelihood to improve with much less cost is greater than if you didn't see a PT in that time. So we are here to help with your acute low back pain. That said, usually it gets better on its own without you having to seek care, and I'm going to tell you how to best manage it. So the biggest thing with low back pain is that usually there's more hurt than harm. So it hurts a lot. My most recent flare-up, like I could barely get out of bed, I could barely put my shorts on, and I was having sharp shooting pain in my back. It was really just my muscles protecting. So less than 5% of the time is your low back pain with any sciatic stuff something that you would actually have to do something surgically about. The biggest things you're looking for is that you're not having obvious weakness in your leg, that you're not having numbness where you would sit down on a bike seat or where you would wipe when you're going to the restroom. And so those are the biggest things that you're looking for. If those things are happening, call your physician, or if it feels like an emergency, go to the emergency department right away. But for the most part, it's usually just good old-fashioned low back pain. So what do you do when your low back hurts? Well, really, it's a couple things. Number one, you try to stay as active as you can, doing the things that rocket science don't make your back pain worse. So anything that you do when it hurts you, you kind of run it through the filter of, is that a hurt so good, and is that an acceptable level of hurt? If it's kind of a hurt so good, kind of feels good to push into that, and if anything you feel like you'll feel better, go ahead and push into that. If it's a hurt that's like, no, like if I keep doing that, I'm going to be way worse later today and the next morning, then kind of avoid those activities. So with low back pain, we can put you into 3 categories. So the first category is basically a manipulation category. And so that goes right here. And so with manipulation, those are the people, usually they're people that are a little stiffer in general, where if you see a physical therapist or a chiropractor or a doctor of osteopathy within those first 14 days, you get a nice manipulation, it can have instant relief. And go ahead and check out our video of kind of the self low back manipulation to kind of learn how to do that yourself. Okay, so manipulation. Then number 2 is directional preference. So even if you're manipulation, and then even if you're in our third category that I'll get to in a bit, you always want to look for a directional preference. So about 40% of people with low back pain have a directional preference. What the heck is a directional preference? So a directional preference is if there's a direction or position that feels better, or there's a direction or position that feels worse. So we usually simplify that with if forward bending is worse or better. And usually with forward bending, sitting would be the same as that. Or if back bending feels better or worse, and usually that would also correlate with like standing and walking. And so I like to think of kind of this, what we call this bias and sensitivity graph. So basically when we draw that in here, we draw that in, and so over here we have this nice back bend. Okay, and so you're bending back, and then over here we have this nice toe touch. And so that's flexion. And so this is flexion, or like sitting. And then this is what we call extension, or like standing, walking. And so those usually go together. And then we've got this nice middle chunk where you're just kind of straight up. Okay? So typically with low back pain, you usually are going to fall into an area. And so let's say that you hurt your low back and just sitting is terrible. You go to bend over, it hurts you. But like standing is a little bit better. It's not perfect, but it's better. So basically, you would fall in to where you don't like that. That is what we call you're sensitive to it. That's ouch. And then the back bend is your bias. And that's okay. And then sometimes maybe the end range, you don't love the end range. So this is where you want to live. So if that is you, how you would notice that is, ow, hey, that feels pretty good. Oh, the last little bit kind of hurts me. And so if that's you, you want to check out our extension exercise progression. And that's where you start to manage your pain. That said, daily you recheck your flexion. And the biggest thing to really improve is that you would restore your flexion long term, and you would also work through our flexion protocol. But you would only start doing that once you can do those exercises and you're not worse the next day. Or you would be the opposite, where sitting and bending forward feels really good and the back bend stuff hurts you. Then you would start with our flexion-based exercises first, and then as you get better, you'd work into our extension-based exercises. So number 2 is that directional preference. If you can find that, that's great. And then every once in a while, your directional preference is in the middle. And so with that, you would end up really doing more of our third group, which is kind of our motor control and strength group. And so that would be our third group. So whether you're in the manipulation group or our third group, the motor control and strength group, always look if you're in our second group, the directional preference group. And sometimes you're not, like everything hurts, and then you just try to be as active as you can and kind of find the positions and things that are like the least worst. Okay, so then number 3 is our what we call our motor control and strength group. So these tend to be the people that are pretty flexible, like our yogis and all of that. And you're just so flexible, you're moving so much at your back that the best thing is for us to learn to control your back better and kind of keep a neutral spine. And so we start with a lot of our neutral spine strength stuff, and then we branch out into our flexion and extension and rotation stuff. So in summary, we've got our manipulation group, we've got our directional preference group, and then we've got our motor control group. And the first group you're looking for is actually really first, do I have any of those red flags of weakness or numbness where I would sit on a bike seat or wipe? And if that's obvious, then you'd go see your doc right away. Or if it just isn't mechanical, it hurts when you eat or at the same time every night, or it's just really random, doesn't seem to be mixed with that, those are the things you'd see your physician for. But assuming those are no, then you go into that next section. And really the next thing to do would be to watch our videos as far as our flexion base and our extension base, and then our motor control progressions. And so work through those YouTube playlists. And usually that progression will work. If there's any one exercise in there that for whatever reason is like hurts more than is tolerable and is making you worse the next day every time, don't do it. And then other than that, just try to be as active as you can with walking and activity. The people that do best with low back pain are the people that stay as active as they can with the things that rocket science don't make it worse and move forward. So that is it with low back pain. It is usually more hurt than actual harm. The other big thing that I'll throw in there is the whole imaging thing. So to kind of wrap it up imaging wise. So there's a story, I believe it's in the Spine Journal, and what they did was they studied an Aboriginal group in Australia. And what they did for one study was they showed up and they just surveyed the Aboriginals, basically. Do you have back pain, and is it limiting you from doing the things that you need to in life? And so on this first survey, a lot of them had back pain. Very few were limited or disabled because of their back pain. Then over time, they brought in some Western medicine with some physicians and some imaging. I don't know if it was any more complex than an X-ray machine. I can't recall. But all of a sudden then, when they return after they've had that for a while, massive disability in this Aboriginal group in Australia due to back pain. And when they start getting and delving into it, they ask him, why does your back hurt? Oh, well, I was told I have the spine of an 80-year-old. Or, oh, I was told that I might blow a disc if I bend forward. And so it was actually their beliefs about their body that created the disability. So just to build on that one more, there's a great study, there's numerous of them, but specifically Brinkinji et al., 2015, I'm spacing the journal. And in that study, they took a bunch of healthy normals and they imaged their low back, and what they ended up finding was that basically for every decade of life, that percent of people, and these were people without back pain, showed that they had degenerative disc disease or arthritis. So for 50-year-olds, about 50% of people without back pain had degenerative disc disease or arthritis. And around that amount too had disc bulges or herniations. And so with that, can you imagine that that's already in your back? You go and you like help a buddy move, and then all of a sudden your back hurts, you get an image. Oh my gosh, I got a disc, that's my problem. No, the disc was already there. It's actually other painful stuff that's going on, and you can improve. The other thing that we've seen too with disc bulges is when you follow it up with imaging, whether people had PT or not, oftentimes 3 months later that disc bulge has regressed. So that's not to say that there aren't disc bulges or herniations that do compress a nerve, that do create that weakness and the numbness stuff that you do need a surgery for, but much more often than not, it just it's part of the human experience. We're not invincible, and usually you can get better, and it can even look better on imaging despite it. So all that said, your beliefs about your body are huge. So that's not to say that you shouldn't get an x-ray or have some imaging, but really your symptoms should correlate. And if it's back pain without the weakness and the numbness stuff, usually you're going to get better by being as active as you can, seeing what subgroup you are in, and then kind of progressing. And then make sure wherever you were limited prior, restore that mobility. So I hope that's helpful. I hope that gives you a better understanding of low back pain. Now check out our videos as far as our flexion-based progression and our extension-based progression and our motor control progression. And then really to really nail it, you would start where you're supposed to start based on your findings, but you would then be able to work through the other progression without it aggravating your back, and that will make your back stronger and more resilient long-term. Not that you won't have other flare-ups, but basically the stronger you are, more mobile you are, the better off you'll be. So hope that helps. Low back pain is so common. I hope you find this information helpful.